building.
Yo.
Hi.
Thank you. Thank you. It's
I
good
love
to
the
be here.
Adire.
Thank you.
And you and I are blowing. We're blowing today.
Yes, so we're on the same flight. Can you imagine?
And we're a bit distant.
Even
are you distanced?
Socially distant. I can't touch you anymore.
He's not touch anybody. How you doing?
Even your arms, lace, my arms.
Yeah,
Yours are shine.
We're really in sync today.
Okay.
How
There is God, though. There is God.
What's up with you?
I was going to talk about these cars that go on the wrong. Anyways, in the papers, maybe I should just leave it.
Okay.
Because
one way. They're really arresting them in this Lagos. So I know somebody that's the person is even very close by. Really? They arrested. She went to go and pass where she shouldn't pass. Last man took her car. Poor girl. She suffered a matter. She had to pay through her nose to get that car out eventually. In fact, she was scared they would try to auction off her car. But the serious that with all the connection we tried to use connection. No connection.
Pay your money.
Pay your money.
Yes.
Because everybody that was callable. Everybody said go and pay your money.
If me, I will not even go and beg. I will just ask. If they catch me, I will just ask how much.
How much is it?
If I don't have the money, I'll go and beg, borrow.
Anyway, Nima, how are you?
Nima is full of emotions this morning.
Oh. Yes, so you should.
So thanks to some unprofessional journalists who would refuse to do an interview or find out how a story is. I'm trending for the wrong reasons. Some people are commenting that I killed my child and that to save 3.6 million. So our January 1 topic was about the woman who had 3.6 million but refused to pay 25,000 naira for her child's hospital bills, and the child died. Somehow my face is now the face of the woman who killed her child. And I asked them, because maybe you've not gone through that experience before. It's not something that I want to relive in my life. It's too sensitive an issue, and I'm going to take it up. Those bloggers are going to go down for it. Wherever they are, I'm going to take it up legally with all of them. I'm not letting them go this one. Because it was
actually very insensitive. I mean, look, and they're not, I wouldn't call them journalists. These are just opportunists. So they believe that, okay, because the platform is available, just write anything. They want to get traction.
They did.
So they gained the traction.
They gained traction.
So
that's everybody in Lagos.
Put somebody's face there,
yes,
and then imply that the story is about you.
I woke up yesterday morning. My Lasso Law 2010 group, it was there. My friends from Ministry of Justice were sending it to me until late last night. I refused to react because I usually don't go online to social media and their comments. But when they started sending me links, so read comments now, Auntie. It was too much for me.
I think it's very sad that people are so unscrupulous. Just because I want to gain followers or gain popularity, let my blog.
If it was even a true story,
destroy another person's life. I think it's so.
What is it?
I pray they lose peace of mind wherever they are.
Yes, just the picture and the caption is enough.
That's
no, one of the stupid blogs, he said. He put my picture there, the headline of that story, and went under his comment without giving the story itself and saying, okay, this was a topic discussed on the show she works on. Goes there and says, fear women.
Implying that
this woman. So comments were rife. And my friend was saying, Nima, you need to read this comment. I even refused my husband because he saw me walking up on this. I'm making this particular one I'm going to sue them.
These are elements. Yes, we are going to do this together. It's total rubbish.
If you don't make an example of them, two of them, gistrew.com, only in Nigeria, and a few others. All of them, I know your names, and I'll make an example of you. So this is not joking at all. You have seen your mother's co-wife.
I'm
I love what you're wearing, though.
Thank you. Thank you so much.
I love the top.
Oh, thank you.
This is so lovely. Very corporate. You can actually go for an interview.
Yeah, very corporate.
Very corporate.
So
Mary, how are you doing?
I'm fine, thank you. We have a shout out.
Oh, please go ahead.
Yeah, so this person, the person's name is Rohan, and sending a birthday wish for the mom. She's Mrs. Olanike Sadiq Adams. It's a belated birthday message because her birthday was on the 2nd of January, but because of the lockdown in London, they couldn't get to celebrate her. She's a very big fan, the mom, that is, a very big fan of our show, and she would like for for us. And the daughter and the siblings would like for us to please shout out to her and wish her a happy birthday. Wishing her love, joy, happiness, good health, sound mind, and more blessings. May Almighty Allah grant her many more years. Amen.
Happy birthday.
Happy birthday, ma.
Because I was ranting, I missed. Mrs. Olufunke Dairo is wishing Damilola Elesomi happy 21 years on earth. Happy birthday to him.
Happy birthday.
Now I'm trying to see if I can find any right
somewhere.
now. Oh,
I wonder if people send me. I
Okay,
just don't know.
okay, I got the same.
Okay, let's go on a break. That's what we can say. Well, your birthday is today. From the ladies of your view, happy birthday. Many more years. God bless you.
Yes, or your anniversary.
Yes, yes, yes. Let's go on a quick break. When we come back, we go through the front pages of the papers. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Okay, we're going to start with The Nation. 20% of COVID-19 tests returns positive, says PTF. You recall, before it used to be 10%. Now it's actually doubled. Ondo orders headers to quit forest. Stock exchange to list shares for trading. Who is who on Nigeria's ambassadorial list? Anxiety lingers in Kwara APC after meeting. Showing Kakuka's position on State of Nation in order. And picture here as low turnout in public and private schools. Right. Which story are we taking?
We're taking the ambassadors.
Yes, the ambassadors. So eventually, they've named them. You know, the story started
Who is that?
when
Which story are we
took
taking?
our embassies not having any, designates there, and they appointed some ambassadors. I think 43 of them were career ones, and the other were non-career ones. And now they've named them. So we have a new ambassador in the U.S., and she's a woman. She's Dr. Emenike. She used to be our ambassador in Ireland and Iceland as well, I think. And several others, they've been named. So if you need all the list of names of 100 and something,
congratulations to them.
Yes,
Well done. We're happy and proud of them.
We are very proud to, for the woman. She's had a 30-year career as a diplomat, and she's been outstanding. So,
all right.
So I have the NDLEA story.
Go ahead,
so the NDLEA recovered 2 suitcases at the Nnamdi Azikiwe International Airport in Abuja, and when they searched those suitcases, they contained cocaine weighing about 21.9 kilograms, and they say this is the largest ever. I mean, in a long time, in a single seizure from the Nigerian airport, and that they came in unaccompanied. There were name tags attached to I think we should call their names, Akomaye Ife and Ize Lusaka Yu. May not be their real names because no one has come to claim the bags. They left them at the airport for weeks. They came on an Ethiopian airline, and then when they tested it, there were just bags and bags of cocaine in them. It was really scary.
Let's move on now. Moving on now to The Punch. School resumption. NUT meets Thursday over COVID-19 rules. Partial compliance recorded. Picture here of the pupils in Oshogbo, Enugu, Akure, and Maiduguri. Lagos to auction 88 vehicles seized for traffic violation. Futa demands highway security as short registrar dies. Religious fanatics twisting Kuka's statement to divert attention, says Shoyinka. Amotekun alleges Oyo Okada operators working for kidnappers. PDP woos Okorocha as ex-governor Lampoon's APC plans party. NDLA seizes 21.9 kg cocaine at Abuja airport. And Telco submits 43 million NINs to our NIMC for verification. Okay. COVID. Should we start with COVID or which one?
I was going to talk about the Lagos State's
88
vehicles.
Yes.
They've forfeited the vehicles they've impounded them for going on the wrong side of the road, and they're auctioning them. I think it's tomorrow, Wednesday, January 20th.
88.
So 20th.
These auctions,
tomorrow,
how do they work?
It's at the Alausa Ikeja car park. I'm announcing it for you if you want to need a car.
if your car is there, find someone to buy it for you.
Okay, so I wanted to ask if your own car has been seized, can you buy it
I think
back?
it's plenty, so you can.
I don't know if you can buy your car back, because it doesn't say that in the
You can buy it
paper.
through somebody, I'm sure. But I think the idea really is that Lagos State government is taking this thing serious, especially those driving, breaking traffic rules, driving on one way, disobeying
Can they
traffic
just
laws.
add Okadas?
into this
to
city.
this because they are the biggest culprits.
Why they did?
On the express,
What they do?
you are all going like this, and they will come like this, and they feel it's their right.
Yes.
What about Danfo drivers?
They
Same
enforce
thing.
enough on Okadas. The tax force I know on Okadas are very, very
But then
strict.
it does not seem
but
like they
on
have
the
been-
on the one way, you know, Okadas are faster. But I know that the Danfo buses
Yes.
are not that fast. So why are you not enforcing? This morning, it wasn't even a Highlander on one way in the middle of everywhere in Malton, and the person was working with all audacity. So, you know, they should enforce.
Okay.
lawfully.
Any other story?
They shouldn't just choose. Everybody should go.
Yes.
If me and they arrest me,
Let's move.
Which story do you want to take here? No other story.
Just
We'll
that
take. Let's talk about COVID now. You don't want to talk about COVID. NUT, they actually the NUT boss says there's a meeting on Thursday. Right now, I think maybe between now and Thursday, they're going around inspecting schools to see who is compliant, who's not, and then on Thursday they get to put the able to have
Okay,
a
since you've
position.
just picked it up, let's just pick up the different COVID stories from the
enjoy
papers.
them,
The federal government is saying that they're actually not in support of schools reopening, that this is a decision that states take, and the federal government do not have that authority to stop state schools from reopening, but they themselves do not think this is the best time given the numbers.
they said the government has 100 schools.
Yes.
As opposed to the thousands.
Yes. Yeah.
That's controlled by states and individuals.
And then The Nation, they had a reporter who had gone around some schools, and they also reported non-compliance in some schools, kids just standing together, no mask on, you know, it just does not seem like, you know, they have a proper handle on...
On the vaccines, they've handed over some, the distribution of vaccines to governors, and they've approved local production of vaccines with a 10 billion naira grant for local producers to, produce vaccines. But then the executive director of the National Primary Healthcare Development Agency, Mr. Faisal Shuaib, was saying that, debunking those people spreading rumors about the content of the vaccine, saying the vaccines, in the country don't carry microchips or alter human genetic information. There's nothing wrong. I'm just wondering if we cannot produce yet. How can we tell if they don't have?
And one more story still on COVID. Many of the reporters who actually reported partial resumption as in all schools, what happened? Some of those schools broke the kids into two. So into two groups. So half the kids came to school, half we expected the next day. So they alternated resumption. So the allegation that was partial resumption, not all schools, not pupils came to school, it's in some cases was false, because some schools actually had
to just
partial
add to
resumption.
that, what some of the schools said that one of it could be school fees issues, and second was just that many parents are still uncomfortable, especially private schools in Lagos. Many parents are still uncomfortable in
Final
sending
paper,
their
Daily
kids
Sun,
to
one more paper. The FGLA's fears on COVID-19 vaccines. We have the Commissioner for Education, Mrs. Folashade Adefisayo, here inspecting schools. COVID-19 second wave, governors decide vaccination kickoff. 11th hour fireworks over ambassadorial postings. 2023 IPOP Kanu under attack over anti-Igbo president's comments. Okay. So yesterday also, in addition, the Commissioner for Education was going around. She was in Ikeja, Algege area, inspecting schools, many of which some complied, others had partial compliance here and there. But in the nutshell, I think generally they had a good turnout of pupils, and some schools had water, some schools didn't have as much water, but I think generally they had very good compliance in Lagos State so far. Other states had issues,
yes,
but I think but Lagos State so far seemed to have very good feedback.
I think the picture was in Tribune or something. In Maiduguri, where nobody in the classroom was.
Yes, it was in the
together.
picture actually. I think the picture, one of the papers had it.
Might be Tribune.
Okay, moving on to Nigerian Tribune. Akeredolu gives herdsmen 7 days to vacate forests and reserves. 15 million Nigerians on drugs, says Marwa. Flood inflation, 300,000 metric tons of maize to be released in February. Soyinka backs Kuka, condemns double standard. 22 Kwara legislators, 7 federal lawmakers support APC chairman's removal. Okay, major headline. Who has that story? I took
it in another. You take it.
Okay, so in the Tribune, the governor, after a closed-door meeting, security meeting with Hausa, Fulani, and Ibera communities in Ondo State, agreed that he gave them a 7-day ultimatum to get registered on that for grazing, because they have a law against open grazing. They should get registered. Everybody who intends to continue to carry their cattle on open grazing should have their names on a register so that they can curb insecurity in the state. Not that, you know...
He also bad. There was an executive order to have all of them leave in 7 days.
The reservation forest.
And also because many of them, according to even one of the Amotekun heads, saying that the Okada riders have been aiding and abetting many of these kidnappers. Because if I have a friend actually went through that, she was her rider, Okada in Oyo, exactly Oyo, took her right to the place where kidnappers actually grabbed her. And she was screaming, and she left everything and she ran almost naked. She left everything and she ran to the highway for help. But it was the rider that took her to where the kidnappers could grab her.
But what was she looking at? Why did she knock his head and jump off the bike?
Okay. So anyway, in Ondo State, it was the governor was saying that most of the those who had been rescued said that many of the headsmen were sort of complicit in this in the kidnapping, and that's why he wants to make sure that only those who have been registered can graze within their reservation.
So the forest reserve for me is of concern, allowing grazing there. Forest reserve, of course, you know, help during flooding because we, you know, reserve the trees and everything in the forest. But if you allow grazing in those areas and they're just banning it now, I think they should look well into the environmental implication.
The maize story. Metric tons,
maize, yes. So we're going to be releasing 300,000 metric tons of maize to curb, you know, food inflation, of course, as in response. That's what the CBN is planning to do through the Anchor Borers program.
Okay. Fortunately, that's what we can say. We can't take any more stories right now. Is there any other major story we missed, or you want to run that?
NIN.
Yes, NIN.
Anxiety over the deadline. Today is supposed to be the deadline, and many people are complaining that they have been unable to get. Of course, we've seen the numbers and the crowd, and not everyone has gotten their NIN yet. But according to reports, there's some hope that the deadline may be extended.
I think somebody was saying that they should get an open field. Was it you? Get an open field, have various
points, right?
And then have people come in one by one, stand in social distancing.
That way they won't make money.
Extending it. That's what we thought.
We missed a report last week of people selling their NIN numbers now, or their registered phone numbers now, to people who want to register new NIN. So that report was in the paper. I read it last week. Wow. And maybe while we're talking, I missed taking it. I still have the copy. But those people don't know that they will deal in the future with personality theft. And all the other
we need to make this a topic, not just because our mentality.
The people are then asking, you want to...
I was telling Nima during the break that I got from a reliable source how the gas cylinders they buy to help those in the hospitals are not coming full. So a nurse gives a patient a gas cylinder, hoping to help for 3 hours.
Oxygen.
Oxygen. Thank you. Oxygen for 3 hours. After 1 hour, the patient starts gasping for breath.
Oh,
and she's wondering, this is supposed to last you 3 hours because they come half full. Who does it? Nigerians. Our people. We are the ones hurting ourselves. And say it's government. Government, yes, has their own plan, but at some point we need to focus on how do we begin to change our own thinking, responsibility to each other.
Well, I agree with you there, but one thing I have to tell you is that you are as good as who leads you. So it is strictly, it is the example that they are showing that has trickled down to meet us where we are, because the government is, a lot of government officials, I won't say the government, but a lot of government officials are unscrupulous. It trickles down. That is where fella says, teacher don't teach me nonsense. Who be teacher? Who be government teacher? Culture and tradition. It's a layered thing that starts from the top and trickles down to the bottom. And because over the years, not blaming only this government, but over the years, since I was a kid, the governments have been unscrupulous, and they get more unscrupulous as each government comes in.
Unfortunately,
we have got a bunch of unscrupulous Nigerians.
Okay, on that, we're going to a quick break. When we come back, we move on to something for the day. Stay with us, we'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. So, with the rising case of COVID-19, we'll continually talk about it because it's important that we keep Nigerians updated and informed on all the issues surrounding COVID-19 and our own responsibility towards it. Now, joining us on the show, as usual, is Dr. Japhet Olubugi. He'll be joining the conversation to give us some insight into what's happening in the IDH and other regulatory bodies around COVID. Good morning, doctor. Are you there?
Good morning, I'm with you.
Dr. Japheth, okay, you might have to speak up a bit louder. I can't hear you so clearly.
Good morning, I'm with you.
Oh, fantastic. Great to have you on the show. So, Dr. Japheth, I mean, YK in the past few weeks will say she's been hearing people that have been dying here and there. And we will tell her, YK, it's only you. We don't know anybody. But as of today, I can boldly, confidently say that we know people that have unfortunately succumbed to COVID-19 virus. Now, tell us exactly the reality on ground, because many Nigerians still are nonchalant towards protecting themselves against this virus. Could you just give us an idea, the real picture out there?
Thank you very much once again for having me on the show. Well, we can see the figures rising. All the noise, all the information we have been hearing on social media, on TV, and all around, they are all true. In fact, the situation is worse than we are even perceiving in the society. The reason being that all those figures we see every night from NCDC are just a picture of those who actually get tested. There are several people out there, even far more than ×2 of the figure that we see, who actually don't bother to get tested, who treat malaria, who they just have symptoms of flu and get treated. And then also at the isolation centers, we just hear what is happening there. You are not seeing exactly what is going on there. There is a lot of trouble that COVID-19 is giving us right now. As of yesterday, the isolation center at FMC Epicenter is filled up. The one at Lasuth is almost filled up. IDH Yaba 1 and 2 are also entirely filled up. And the one in Luth is about 75% capacity. Wow. The one at Lekki is also almost filled up. So all the isolation centers are almost filled up. And people are still coming in trickles to the isolation center. Now, I'm sure you must have also heard that there is a dearth of oxygen at those isolation centers. Yeah. And that is because a lot of people are requiring oxygen because the virus dwells in the respiratory system. And when it dwells in the respiratory system, it gives a lot of respiratory troubles to the patients who come down with COVID-19, especially those who probably have asthma or some form of respiratory disease or the other, and those who have heart conditions. These people are not finding it funny at all when they have COVID-19. So there's a whole lot of problem now in the society due to COVID-19.
Yeah. Okay.
What we call a high morbidity, high mortality. Mortality being increased number of deaths, morbidity being increased number of disabilities or sickness. Amongst the people.
Right. Let me get a few more questions in for you, Dr. Japheth. Go ahead.
So, Dr. Japheth, you know, during the first wave, we had lots of, the way it was described, we would hear, oh, they didn't have too many symptoms. We were just putting them away, you know, in these isolation centers just to watch them. We never heard that people had symptoms. In fact, we saw videos of them dancing and singing in the isolation centers. What are the sort of symptoms that are people experiencing this time around, and why is it so much more concerning than the first time around?
Yes, thank you very much. That's a very important question. That's because this time around, the kind of symptoms we have are even more serious than the ones we have the first variant. And that's because some people, there are about 4 categories of people who come down with COVID-19 now. Let me say the first category may not show any symptoms at all. Now, the second category may show symptoms like weakness, body aches, respiratory tract infection, which comes in form of voice hoarseness or voice cracking, or even some cough. So these people may not have fever. Now, the third stage are those who would have weakness, body pain, some cough and fever, and also lack of smell and lack of taste. Now, these people may think that they have malaria because their mouth may be bitter. Now, once their mouth is bitter, they think they have malaria. Once they have fever, they think they have malaria. The body pain, the weakness, they think they have malaria. And then they start using malaria medicine. Now, when you use malaria drug for this type of symptoms, even after the completion of the malaria medicine, the symptoms do not subside. The symptoms do not stop. They still continue to have those symptoms that they have. That is COVID-19. I was speaking to somebody last night. In fact, the individual is a nurse, and she was arguing with me that she did not have COVID because she thought she had malaria. And then she thought because she did COVID test, and he told her that the result she did at first was inconclusive. And then she did another one, and then it came negative. And she thought she did not have COVID. It is COVID, because even at the first wave, during the first wave, any result that came out inconclusive, and the individual shows some symptoms that are related to symptoms of COVID-19, we treated them as COVID until COVID otherwise.
Right.
Now, when you have those symptoms, the symptoms of COVID will not go in a week, unlike the symptoms of malaria. Those who have the pain, those who have the weakness, those who have the cough, will tell you that even after testing negative, the symptoms still persist. It may reduce a little, but those symptoms still persist. Now, this is COVID until proven otherwise. Now, some people may not even have loss of smell. They have loss of taste at first and loss of appetite. And then because of that, they think it's malaria. Then after a while, after a few days, they start developing loss of smell as well. Now, when you have loss of smell coupled with loss of taste, it is COVID until proven otherwise.
Okay, all right.
So most people out there now who are treating malaria are actually treating COVID, but they do not know, or they are in denial. And there are a lot of people out there who are doing this. There are a lot of people out there now who are taking the oral zinc, who are taking the vitamin
Okay, let me pause you for a second, because I wanted to get a few more questions in for you. Go ahead, Waki.
Yeah, I was going to ask, the isolation centers you've closed, have you reopened them? Because there was one on Agidimbi Road, one in the landmark one. There were so many. And then the second thing I wanted to ask you is, you're saying you might have had it, then you now test negative. Those people that test negative, can they now still transmit the COVID? Are they going to isolate forever since they continue to have the symptoms or the ailments?
Yeah, those who test negative, it is not everyone who tests negative, positive, that have to go to the isolation center. Like I said, some of the symptoms, the first part of the symptoms are those who are actually very severe, those who cannot breathe well, those who have serious cough, are those who have serious fever. And these are the people that actually are needed at the isolation center because they need supportive therapy. They need probably oxygen. They need some certain caliber of drug to make them feel much better or feel fine or even breathe better. These are the people that the isolation centers are taking, because if we decide to put everyone in the isolation centers, believe me, if you open 20 isolation centers in Lagos, it's not going to take everybody that is coming down with the symptoms.
Okay,
so there are some category of people that are doing home-based care. Now, this home-based care are those who have mild symptoms of COVID-19 and they have tested positive. They are being given some supplements and some drugs and an advice on what and what not to do to be able to deal with the COVID-19.
Right.
Now, these people naturally may get better in a number of days, from 2, 3, 4, 5 days.
Okay.
They may get better, unlike those.
All right, let me pause you there for a second. I have a question, but let me come to Nima.
Dr. Olubugi, let's not create panic out there. Malaria is still very common, popular illness amongst us, And when we say if you have the symptoms, you are most likely COVID, most people will just assume and start to panic, and we don't want people responding to panic and going, crowding the test centers. You need to be very clear. I had a relative last week who thought she had COVID. I tried to convince her that it was mere malaria, stay home and, see if the symptoms change for worse, but she would not listen. She went, to a crowded test center and got a negative test result before she calmed down. So how do we, can you specify what exactly you must have before you are sure and you need to go for that testing?
I'll let you answer that question after this break. Stay with us. We'll be right back.
Stay tuned. Your view will be right back.
Thanks for staying with us. So before the break, Nima asked a question concerning how do we differentiate those who have malaria and those who actually have COVID?
To prevent panic.
Dr. Japheth, are you still there?
Yeah, I'm with you.
Yes. Could you help us answer that question, please?
Yes, I did say earlier on that the symptoms of COVID-19 would persist even after you have finished taking anti-malaria drugs. So when you take anti-malaria drugs and you still have those symptoms, they are not going down at all, you have COVID-19 on top of you otherwise.
Okay.
Apart from that, the classical symptoms of COVID-19 now includes the loss of taste and loss of smell, which ordinarily are not associated with malaria. When you have malaria, they are not.
They are associated.
You are not going to have. Yeah, the fight can be bitter. You may have loss of appetite with malaria, but you're not going to lose your sense of smell or sense of taste.
Right.
Now, apart from that, most Nigerians, they know when they have malaria. They will tell you that I'm weak or I have body pain, so I have malaria. Now, this kind of body pain you have with COVID is not the kind of body pain that will go away when you take painkillers. The pain persists even after you've taken painkillers, or it comes back almost immediately, and it may even be stronger than what you had before. So this is classical of COVID-19.
Okay, let me ask you a question. Dr. Japheth, let me ask you this question. So there are people listening to you right now. They understand that the IDH isolation centers cannot accommodate a lot of Nigerians. So they are the first or maybe even second stage where they know they have COVID. Now you told them that they should use, who do they call exactly? Where do they go to for help? Is there a number they can call for Lagos State government? Is there, or even across the country? How can they get help and to know what to do to begin to treat themselves because they can't go to the isolation centers?
Well, I didn't quite get the question, but I heard something about isolation center and how.
No, let me rephrase quickly. I'm saying that people can hear you and listening to you right now, and they are maybe on the first or second stage, or maybe they only have the coughing, the initial symptoms they are showing, and they got a test and shows that they are positive. They can't go to isolation centers because they've not gotten to that chronic stage. Therefore, they're asking, what can I do? Who can I call to know what to do to maintain myself in the house right now?
Yes, they can call the NCDC toll-free line, or they can also call the Lagos State 0800 Corona. People from the other end would advise them on as to what to do. If they cannot do that, they can also visit any centers, any hospital around them. They will advise them as to what to do. Now, there are primary centers in Lagos where you have kits for home-based care. You can also visit any of these. Once you test positive, you are entitled to a part of that home-based care, which they can use, and then they can also get advice on what to do and what not to do to help deal with the symptoms that they're having at that moment in time.
So, Doctor,
Yeah. So talking about stopping going to a hospital when you have tested positive, I just want to talk about the medical personnel working there. And one of the issues we had the first time around was PPEs. And there are stories of people not getting, when they go to the hospitals, not getting the sort of attention that they need, because of course, even the nurses and doctors are wary of who may be coming with COVID. What exactly do you have now that is better than before? Do you have your PPEs now? Are the facilities very well equipped now? Are you comfortable to carry out your first responders duty in the, right now?
Yes, I think to a large extent, for the government facilities, government has provided PPEs, although it may not be enough, but government has actually done well to provide some PPEs for the health workers. Apart from that, the health workers now they are not oblivious to the fact that everyone has to protect him or herself. So they are protecting themselves as well. Now, the Nigerian Medical Association would like to urge the government to provide more PPEs for the areas that still have shortfalls, so they have all this data. So they should endeavor to provide more PPEs so that people can protect themselves. As it is now, the hospitals are getting filled up. The hospitals, the health workers are being overtasked. And let me also use that opportunity to appeal to the government to pay the hazard allowances and other allowances that are due to the health workers to them, so that this at least serves as some form of motivation to them for putting their lives at risk and then the lives of their family and loved ones.
Doctor,
I wanted to ask you, the way you described the pain, I wanted to ask if you have experienced it yet. Have you had COVID yet?
Well, don't forget that I'm a physician. This is what we do from the time immemorial. But apart from that, I may have had COVID too. That's not to send panic into anyone, but we are frontline workers, so I may have had it as well.
Well, have you been tested, or you didn't test?
Yes, of course. Of course. I tested several times.
Yeah.
okay, Dr. Olubugi,
But I'm not going to tell you the results.
No problem, no problem. Me too, I won't tell you my own. If I do test, I won't tell you my own results. But sorry, Nima, there's just one more. There is a medicine going around the social media. I've got several texts. I went to a pharmacy the other day and they recommended it to me as a prevention. It's an antibiotic, Ivermectin or something. Is there any truth in this?
I didn't even know.
Well, I was hoping you would never ask that question because I don't want people to take whatever I want to say out of context. Ivermectin is an anti-parasite and antiviral drug, and it actually works well in preventing having some form of stoppage to the action of the viral effects of COVID-19. Now, we have been using ivermectin before. In Nigeria, we use it for a lot of parasitic infections in Nigeria. So yes, it has some form of effect on COVID-19. But then again, it is not a total cure for COVID-19. As it is, there's no cure for COVID-19. So ivermectin is one of the drugs that can have some form of effect on COVID-19.
Right.
Now, if people try to rush to buy it, the producers, the distributors will only increase the amount of the price of the drug because of the demand and all that. So what we need to do is to prevent ourselves from even getting down with COVID-19 in the first place. And that is by wearing our face masks, by washing our hands, by maintaining social distance, and at least practicing cough and sneeze etiquette as much as possible.
We have very little time left.
A lot of people are still going around without wearing them.
ask this question, sir.
All right, go ahead.
So what happens with your personnel handling patients with COVID in the isolation centers when they have a peculiar situation? We had the story making the rounds on a woman who had gone through IVF and testing positive.
That's tomorrow.
Oh, okay, tomorrow. So what exactly do you do to people with their own peculiar illnesses or underlying health conditions in the isolation centers? Do the nurses or your personnel, medical personnel, also focus on those particular things that they have underlying beyond COVID?
Yes, for the umpteenth time, what they do at the isolation center basically is not to cure COVID-19. What they do is to give supportive treatment, supportive care for those who go there. And the supportive care can include giving immune boosters, supplements to those who are there, giving analgesics or painkillers or antipyretics to those who have fever, giving oxygen to those who cannot breathe well, who need supportive oxygen to breathe, and then giving some other care nursing care, medical care, even laboratory care for those who require it. Now, when you give somebody all this kind of care, it can improve the situation. It can boost the immune system of that person. It can also help the person to deal better with the symptoms that may arise until the body clears the virus away from the system. And that is when that happens is when they test negative. Right. And then when they have seen that this individual is doing better with the symptoms, they discharge them. So that is
we have to run up right now, Dr.
Yes.
Japheth. This wave seems to have lots of young people. I mean, we've seen people's 20s, 30s, 40s have passed on. Is there any reason for this, or I mean, or are you monitoring how this is happening, where younger people are being infected and actually dying as a result of COVID?
Yeah, it's a sad occurrence, and we got rest the souls of those who have departed. It's a very sad occurrence. And we are trying as much as possible to sensitize our members and other health workers so that we can all protect ourselves, so that we can all, so that...
Oh, we're having some connection issues right there. Are you still there, Dr. Japheth? We can't hear you. Okay, thank you so much. We've been speaking with Dr. Japheth Olubugi. He's been helping us understand the situation of COVID-19. We'll continue to talk about COVID-19. We're not going to get tired of it because Nigerians must understand the urgency in ensuring we do our own or take our own responsibility in playing our role in curbing and stopping the spread of COVID-19 in our community. That's all we can take on this. When we come back, we move on to other topics. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. So according to reports, infertility affects 12% women during their productive years. We'll be having later on the show fertility experts in women and couples. And we're trying to get Dr. Catherine Abagu on the show, but once we connect with her, we'll start that conversation. But whilst we're waiting for that to connect, your thoughts on our conversation with Dr. Japheth, because the issue, I was worried that younger people seem to be dying, and I was worried that I wanted to know if these young people had pre-existing conditions. You know, it was important to know what are the circumstances that led to the death of it. I mean, what are the stories you've heard, Waiki?
One of the things I noticed about Dr. Japheth is, because, you know, we interviewed him during the first so-called
first wave, because
I don't believe there's any wave. It's just, we have it. So that first time, and now, he sounds more frantic. He sounds more scared now. And he's like trying to pass the message on. So me, I spoke to one commissioner. He said, if you go to the isolation center, hey, he said plenty people and all of them need oxygen. This is from this commissioner, and he said that he went to the isolation center, he was scared. The day I spoke to him was the day that my head, even though my head has been correct, became more correct. No matter who I offend, I'm not going to any events. I'm staying in my house. Event of 4 or 5 people like this that we are sitting, I can do that one. Yeah. But where we are going to be sitting down, jollofi, I can drink in my house. I don't have to drink in your house. You know, so that's
beyond the events and what's it called? Beyond
gatherings.
Gatherings. There are other ways that you don't, know that you might be passing it. For instance, you're on traffic and a policeman stops your car and is insisting you wind down. I don't know why it's compulsory now that we must still carry out certain duties. The other day, a policeman made me bring out my driver's license. I thought I put it in my purse. It fell on my lap, most likely. I got out of my car and I went into the office. Till date, I'm looking for it. I had to go get another copy of that license. Thankfully, I had photocopies of it. But it was during this time, and you insisted I wind down the glass for you. In this kind of climate,
but police will have to ask you to wind down, whether you like it or not.
What are you checking for?
He's doing his job.
He's doing his job. Of my car missing. You stopped the car, you checked my license, you checked, and then you said, Alpha, madam.
That's a different matter.
No,
but you can't
but
accuse
it's a common matter.
But we can't. Him asking you to wind down is part of his job. Because you need to have a conversation.
When I had COVID the first time, one of the things that bothered me was those winding down I had to do because of the stretch of road I had to drive. I had to wind down every time I'm going at least twice to 2 sets of police. So I feel that they themselves should be guarding themselves. And most of them, imagine the federal road safety that stopped me, who saw me trying to wear my face mask before winding down again because wind down was an issue.
But if a police is wearing his face mask and stands a bit of a distance from you and asks you to wind down, is within his purview to do so.
But it breaks my heart because I think they are not aware enough. They're not doing the right thing. They're not protecting themselves. Maybe they are not seeing enough of them, but because I have been burnt, I don't want to be burnt again. I think it should be not being rude.
I think it would be important to know what the statistics are for
within the force.
Yes, within the force. If they are getting infected while carrying out their duty, maybe that will also help them realize that they are also as vulnerable to these things like as everyone else. Because we have spoken about how they go to round up people who are not following the guidelines, round up people in clubs, pack them all up, put them in one enclosed place. You are with all the people to yourself that have, you know, they're just different ways. And that is why I have a problem with the fact that it's as if we speak lip service, government does one thing, and expects us to do another thing. Government will say to you...
Thank you.
That,
I love you for saying that.
Government will say to you, follow the guidelines, blah, blah. We have put everything in place. But just before you get in, there's a huge crowd. Well, that is the crowd. But once you walk past the gate,
that links us up with the NIN issue.
The NIN issue. Before that, I was going to bring a banter. Thank you for bringing it. On Friday, I think it was, I watched Kogi State having an award night.
Yes.
I watched it live.
Are you for real?
I'm telling you.
Yeah, we saw the picture. Yes, we saw the picture.
They were not wearing masks. Yeah. Half of them were not wearing masks.
They don't have
there was crowd.
Now, according to their governor. They didn't have it.
So
they didn't have isolation.
This is what I call leadership by example. Yeah. If you are not doing the right thing, and you expect me to do the right thing, today I was coming, when I was coming to work, I counted how many people I saw wearing masks. I saw like 3.
Still?
No, I saw 3 wearing masks. About 10 wearing their mask here.
On the chin.
And here. Nobody was wearing masks. And so I keep on harping on. They have to keep telling us it's government's duty, whether they like it or not. It is their duty.
We were here yesterday when Toko was saying that when she entered Dubai, it wasn't just about government's duty. The fact that everywhere she entered, from the taxi cab, the taxi driver was telling her, Madam, mask up. Every store she entered, mask up. Why? Because there was a fine that they put the sanction.
Part of government duty
but you see, but the people also need to take responsibility. So I agree with you. Government has their own role to play, where groups, organizations, hotels, certain groups of people are fine, or they have to take that responsibility. If not, if you have to be responsible for those in your own various communities.
Mariah, that sanction is part of government's willpower to enforce it. So the taxi man knows that if he does not make sure his customer wears it, he will pay something. He will pay. Not that he will beg his way out of it. Not that he will call an uncle or a friend or a relative that will get him out of it. He will pay, and that's the willpower. We're not saying government stand with a stick and just be wiping people. We're saying put sanctions there, enforce it, and nobody gets out of enforcing it, no matter if the person is related to you or not. That's the problem.
Right.
You know, there's a sad reality that I came to. Talking to a market woman. So I was saying to her that the least you can do is find your face mask. And she said, oh, no, how much be the profit of my market? So at that point I felt, you know, we've been advocating. Put at every market, public places, hand washing centers, and make portable water available in those centers. At least government can do that one. Local government, LCDAs can do that one. If you're distributing hand sanitizers to people who think it's body cream, why not give them face masks for free?
Yeah.
They've done that. That's the cheapest thing. Almost every leader has given out face masks.
Face mask is being sold publicly at 200 naira. And I calculate my pepper profit. And I cannot afford 200 naira every time.
It's 100 naira. Me, I buy it 100 naira. I know. I'm not speaking for any government official.
Yeah.
But the easiest thing the average government official has done in the last 10 months is giving out face masks. Some of them 20,000. Trust me, these people. I'm not even worried about that because it's not their responsibility is to their people. I even feel beyond that, you have asked us to go and register NIN. The least you could do is make the process of registering should be such that people should learn from it.
Yes.
Exactly.
So somebody was saying, put these tables out, put these points out on in the open field where NIA officials are there and people are there are marks on the floor saying how you stay on social distance before you go before I attended to. So the point is that government must show that example in their various organizations so that people can learn from.
Yes, why should government give any a 30-day ultimatum in the pandemic? That one, the government is not even talking to you. But on the side of, let me just explain something about government and these sanctions. The people that are not complying, those people who are selling on the road, how much do you want to find them? How much do they have? All of them will be in jail. Like your jails, you want them to go and catch COVID in jail?
Jails.
You can't. So we have to, that's why I say information. Information. I will never stop saying it on this thing. Let me finish. Information. That is the key. Information. If you keep showing me, if you show me, TVC shows me isolation center 3 times a day, and I see how people are dying, me myself, I will talk to myself.
These Nigerians are not talking to themselves. Why? Information is out there.
You have to mix information.
People are not listening. Right? Let me give an example.
No,
those people on the roads. Let's just imagine they had an organization. An Okada rider is part of an organization. The market woman is part of an organization. If the government, they have groups. They have units. They have associations.
Yeah.
So imagine government finds the association, pay every member in the market woman, all your members. If you don't wear masks, I'm going to find you. The Okada riders in your groups, your association, will find you. If they have an association, if they don't have, then it's the communication. So you're right. I'm saying
that's why I say information.
But it is there. Right? We cannot tell here that Nigerians don't know that COVID-19 exists. You can choose as a Nigerian not to accept, but it exists.
The largest number of Nigerians don't believe. Yesterday I was going to get school materials for my kids, and I forgot my mask. I went back home, and my neighbor saw me. I said I need to get my mask. She found it ridiculous. Are you going back because of face mask? I said, but I have to. I'm going to meet people outside. She said, She clapped her hand and she continued selling what she was selling. Most people don't believe. So when we say policies...
Okay, let me go on break. When we come back, we'll continue on this. Thank you very much. Stay with us. We'll be right back.
Stay tuned. Your view will be right back.
Thanks for staying with us. So before the break, Nima was saying something. Yes,
so
go
I
ahead.
Said,
please.
when you make policies like the NIN, and by this morning, we still need to convince you, as at the the date 19th of January that was placed as the last deadline. We need to be talking about government shifting and giving people more time to get this done in the calmest possible ways, so that people walk into these centers and they see a crowd, they go home and say, okay, I think I should wait some more days, and allow the crowded places to be properly emptied. I don't understand how government does a policy like this. Until now, we're not debating, as in on the level of where it can really matter, that this thing should be shifted.
Yeah. I will continue to say information. Where government should spend their money, every single TV station, every single radio station, and we have thousands and thousands in Nigeria. Let the people listen to these things. Go to where people listen to. Go to where people concentrate. Go to the market. Put it there. Put it out there. So when you are hearing it, and you are seeing it, and you are seeing people dying, and you still don't take that responsibility, when you get the corona by yourself, we have your place. We have your hospital. For you that didn't listen, is there. Go and die in peace or pieces, as you like.
Wakey, do you know why I believe that we don't have enough information? There's no catchy jingle that any one of us can even sing to ourselves. I always remember when we're doing this, is it the road traffic one with Wale showing? I can't remember. There was a song.
No, there was Zip.
Driver, no kill me for road. It just became a part of our subconscious. We don't have anything about
no check out. Even till today, I remember it. No check out Nigeria.
There was the one on HIV then. It was zip up. Okay. Asking young teenagers to zip up and be stay off premarital sex and all of that to avoid HIV. So there were words we could stay, but this one,
even that
everybody
HIV, they didn't do that HIV.
They didn't do enough. No, this one was UNFPA.
So there's
there
was something Mara was saying about government should have used this NIN thing as an example, and I agree with you. Government would have just, this NIN exercise during this time, you would have made a very big impact if you had used it to show Nigerians how to conduct themselves. If it would have been just one of the easiest PR you would have done for, for the government. I just don't understand when we sit down what we think. And as Nima has just said, why are we asking government to extend the deadline? Why isn't government saying we have noticed this, and so because of that we're extending the deadline, and we have added some other centers or an open place?
So what government does, as they usually do, they don't follow through. So you tell us you've gone to NIS and you've seen their process, and they are obeying the COVID-19 protocols within the offices, but the real congestion is outside. So what is being done to ensure that there's no crowd outside? You're not addressing that, but your own is, as long as our processes are compliant, we are good to go. Let the Nigerian citizens catch it outside.
After NIMC, as their workers came out protesting, and they had a 2-day strike, saying that their own workers were getting testing positive to COVID.
Yes.
So because you see what you are exposing the workers, even though you think you have partitioned enough inside, is the damage you are doing outside is what you're exposing them to. So eventually, when I have mixed with 3 or 4 people who might have it, and I get my chance to come in, and they need to capture you, you will come with your bare face. You put your fingers on the this thing for your data capture to get all your prints, and your face, they will tell you straight it, don't straight it. If you don't straight it, a person will be forced to have to straight it for you. So there will be contact at some point. And if they said this thing can be done seamlessly,
we should wrap up, because there was a tweet that was saying that we are not social distancing. We are social distancing. So
on camera, it doesn't look like it. On camera, it doesn't look like it, but actually we are, because we ensure that our droplets are not being contacted or sharing. We're not sharing droplets.
See where I can take. See where we have to reach to get our cup. So we're far from the table.
So, because people will say, "Oh, you're not leading by examples." We are leading by example. We are social distance on the set. But what is more important is that we are all also taking proper precautionary measures within ourselves. Wearing our face masks every single day. The moment I leave here, my face masks are on. We're using our sanitizers, we're washing our hands. Those things are extremely important. I will continue to say that, because, and the reason why we bring COVID-19 to the fore, because we want, just like Waiki said, information is critical. We need to continue to remind Nigerians of the need to take this COVID-19 seriously and ensure that once you feel any type of symptom, don't always assume it's malaria. You can treat for malaria, and if you are fine, you're okay. But the moment it persists, you know that it's not malaria, you need to go and get tested for COVID-19. Once you're tested, call the numbers to the, I think it's 080 corona.
08,000
corona. If you do that, call that number. I'll get the number, the right number for you. I think Dr. Jaffa gave it to us. We can get that on the screen for you, for our viewers. Call that number. They will now tell you exactly what to do, how to care for yourself whilst you are waiting for your next result. Any other final comments?
Do you have time to take to this? First off, Akimbowa says, in UK here, we regularly inspect businesses to ensure they comply with social distancing rules. I don't think such inspections are happening in Nigeria. Only the saddest part of wearing a mask in the midst of people, is that they pick it as an offense. Offense for protecting you and I cannot understand this. Baba Oloye, information is absolutely vital, no matter how repetitive. Abe, everyone has a role to play, but Nigeria are used to not obeying laws. True.
All right, that's all we can take on the show today. I hope you learned a few things as we have. Have a great day. We'll see you tomorrow. Bye for now.